All right, I have 2 o'clock, so good afternoon to everyone, and thank you for being here today for our media briefing on COVID-19. My name is Ron Aiken. I am DHEC's Media Relations Director. We'll start off today with an opening statement from Dr. Brandon Traxler, DHEC's Public Health Director, following the answer of pre-submitted questions from the media, and then we'll have a live Q&A period. Now, Dr. Traxler, thank you for being here with us today, and I'll turn it over to you for opening remarks.
Thanks, Ron, and thank you, everyone. Thanks for attending today's COVID-19 media briefing. I think it was Dana, but maybe someone else who asked a couple weeks ago if we were going to be increasing the frequency. And as I responded then, no, but we will do these as needed. I want to start by recapping the testing issues that we have seen over the past couple of weeks, and let everyone know that DHEC is working tirelessly with our testing partners and laboratories to get test results to residents of the state as quickly as possible. We know there, as we noted in Friday's statement, most vendors are getting results to residents still within that 48 to 72 hours standard. We continue working with Premier Medical Lab to remedy the issues that they are experiencing so that their turnaround time can return to normal as soon as possible. To decrease waiting times in Columbia, we announced yesterday that starting tomorrow, the Tour Health's testing site that has been operating at 2600 Bull Street will move to the Columbia Place Mall parking lot, the same place we previously had the large vaccination event last spring and summer. The hours of operation will be 7:30 a.m. to 7 p.m., 7 days a week. This is longer time. This will allow space for more testing and will cut down on traffic congestion in the downtown area. In addition, at-home saliva test kits will be available for quick pickup at that same Columbia Place Mall location, and those will be complete with paid shipping to the laboratory. The Bull Street DHEC building site, the parking lot will still offer vaccinations, as will Columbia Place Mall, but there will not be testing at the Bull Street location. We appreciate everyone's patience as we try to work through these testing surges, and we strongly encourage anyone who is experiencing symptoms to get tested as soon as possible. I also want to recap the recent updates to our COVID-19 school guidance and our school and child care exclusion list. The updated guidance states that a close contact may shorten quarantine to 5 days if they have no symptoms, they test negative on a viral, meaning a PCR or an antigen test, on day 4 or later after their exposure, and they wear a mask then for days 6 through 10 at all times at school, except when eating or drinking or when outdoors and more than 6 feet from others. Schools have 2 additional options for quarantine. When necessary, they may use a 10-day standard quarantine period where a close contact can end quarantine after day 10 without doing any testing if the individual is not experiencing any symptoms. Schools may also choose to implement a test to stay program, which would allow schools to perform or accept results for rapid antigen tests on K-12 students who have been exposed to COVID-19 in the hope that more students can remain in the classroom rather than having to quarantine at home. Lastly, a COVID-19 positive case may return to school from isolation after day 5. And the day 5 begins counting that first day is the first day of symptoms. So not when they receive their positive test result, but when their symptoms develop. As long as they don't have any fever and their other symptoms are significantly improving by day 5, then on day 6, they may return. However, they must wear a mask for days 6 through 10, just like with quarantine. If someone is ending isolation or quarantine early after 5 days but chooses not to wear a mask, then they do have to observe that 10-day isolation or quarantine period. While we leave it to schools' discretion to decide, we do now encourage them to accept the results of at-home, over-the-counter rapid antigen tests. using the attestation form available in the guidance booklet online. These updates to the isolation and quarantine guidance will allow students to focus on in-person learning while also keeping them and their teachers safe. We need parents, teachers, and students to embrace the need for vaccinations, masking, testing, and isolation and quarantine when necessary to keep COVID-19 out of the classroom. We are aware of an article that noted that the Richland 1 school district just reported a record high in COVID-19 cases, and we suspect other districts are seeing similar situations. And we saw the highest number of children hospitalized with COVID statewide in today's report from the Children's Hospital Collaboration, with none of the 54 kids vaccinated. Half are members of that part of our population that are still vulnerable and unable to be vaccinated yet, those children under the age of 5. We must stop the spread among our students and in our communities using these mitigation measures, especially by increasing our vaccination rate for everyone who is 5 and up who's eligible. We're seeing that the highest number of cases currently are among those ages 20 to 50, and most of these cases remain among the unvaccinated. Getting your initial vaccine series and your booster when you're eligible is the absolute best way to stay safe from COVID-19, including the Omicron variant. If more residents were to get vaccinated, it would reduce the threat of COVID-19 in our classrooms, in the workplaces, and in public places throughout our communities. Vaccinations, masks, and testing, along with isolation and quarantine when necessary, are the primary tools that we have to fight Omicron and every other variant of COVID-19. We all work together and commit to these practices over time right now, we would finally be able to put this pandemic behind us. Thank you.
Thank you, Dr. Traxler. We're now going to go through our pre-submitted media questions, of which we have 3 today. The first question is, what is the latest percentage for South Carolina's vaccination rate?
So the current vaccination rate for fully vaccinated who completed their primary series for all eligible 5 years and older South Carolinians is 52.3% currently.
Thanks. Our next question. DHEC said last week that it had ordered 500,000 rapid tests for the public. What kind of tests were those? When will they arrive and how will they be distributed?
Sure. So in terms of the 500,000 rapid tests for the public are over-the-counter at-home tests. We also additionally have ordered separately 1 million point of care, meaning they need to be performed by a healthcare worker, rapid antigen tests. But for these 500,000 rapid tests for the public, 100,000 of them have just arrived in South Carolina. Our logistics team is very hard at work processing them and preparing them to be ready for distribution throughout the state. And the remainder of those 500,000 will arrive in the next couple of weeks. And we'll be providing more information in the coming days about how they'll be distributed for the public.
Thank you. And the last question, are there DHEC endorsed crisis standards of care for hospitals in South Carolina?
So there are crisis standards of care or guidance for how to ethically approach patients during times when you have limited resources or staffing in a healthcare setting for the state. These standards are within a report called South Carolina Prepares for Pandemic Influenza, an Ethical Perspective. And that was developed by a multidisciplinary committee of experts from around the state in 2009. DHEC was represented on that committee and endorsed that final product. And this statewide document is guidance around those best practices in a situation such as that, but is not enforceable. In addition, each hospital is expected to have their own crisis standards of care by the accreditation group, the Joint Commission.
Thank you for those answers, Dr. Traxler. Before we open it up for live questions, I want to remind folks that the purpose of this briefing is to inform and educate the public on the status of COVID-19 in South Carolina and answer any questions you may have about it. Any requests or questions other than COVID should go through our normal media relations channels at media@dhec.sc.gov. And as I see some of you already have, and you know, if you have a question, please raise your hand and I'll recognize you. And out of fairness, I want to get to everyone interested in asking questions first before I come back for any follow-ups. So to begin with, Dana Lynn, go ahead.
A lot of other areas, and Dr. Walensky last week was talking about this in a briefing. They're saying, I think 2 years into it, we've all gotten used to the ebb and flow, especially of the positivity rate. But, 30% and higher is still kind of nail biting. But Dr. Walensky is saying a lot of that is people coming in for other things, being tested automatically for COVID and coming up positive. Are you seeing that reflected in South Carolina?
So I think what we're seeing reflected in South Carolina certainly are the highest case numbers that we've ever seen in this pandemic. And as you point out, there's positivity rates in the 30%, which we did see this time last year. However, what we are not seeing as much this year are the hospitalizations. While we are certainly seeing them increase, they are not increasing at the same rate that positivity rate or case counts are. I think that tells us that these are overall more mild symptoms, still recognizing that in individuals it can be severe. And as a result of seeing that it is most likely more mild symptoms, there is the potential that some of these individuals, especially I think you're referring to ones that may be hospitalized, as to whether they were hospitalized because of their COVID or whether they were incidentally found on a screening test in the hospital to have it. And we do not have reported to us the reason for why someone's tested for these hospitalizations. So I don't have the exact data, but I think it is fair to say we're seeing more asymptomatic and more mildly symptomatic people than we did this time last year.
All right, thank you. Isla, go ahead with your question.
Hi, Dr. Traxler, Ayla Farone from WSPA here. We are seeing, obviously, I think people are noticing the long wait time for their test results to come back. It's something that we're also now becoming used to. However, I've encountered a lot of people who say, well, my quarantine time is now becoming shorter than my wait time for my test to get back. So can you speak to that a little bit and just give people a little bit of insight into what exactly they should be doing and if they should even still be going to get tested or if they should just be isolated in that case?
Certainly, and we do recommend that when somebody develops symptoms, it could be COVID-19, we are recommending that's who we really say should get tested. Because of the importance of notifying their contacts if they know they're positive and those individuals quarantining. We certainly don't want anybody to have to quarantine if they don't have to. And so that's where having an answer about the test results can be beneficial. You're correct that sometimes at this point, we are seeing, especially with the shortened isolation time down to 5 days, we are seeing sometimes where they could leave isolation before they get their test results. Especially if they, for example, don't go on day one, to get their test. And so what I want to tell folks is if you develop symptoms, it could be COVID-19, which currently I think we're seeing the most of congestion, cough, sore throat, still fever, shortness of breath, then you do need to go get tested. We do recommend that. But regardless of when you get your results back, the important thing then is to isolate yourself away from others. For 5 days, starting with day one being, with your symptoms. And then as long as you don't have fever for those last 24 hours, that last 1 day, and you're not taking any medicine to reduce fever like Tylenol or ibuprofen or aspirin, as long as your other symptoms are significantly improving, then you may be around people, again, making sure you wear a mask around them for days 6 through 10. Regardless of whether you've gotten your results back or not at that point. Really the clock and the number and the counting of days is more focused for people with symptoms on when their symptoms begin, not when they get their test results back.
Thank you, Ayla. Kai, go ahead with your question.
Hi, Dr. Traxler. I was wondering, so you mentioned that, there are 54 children that are hospitalized right now. None of them are vaccinated and half of them are actually younger than 5 years old. So my question is, what can parents do if their child is younger than 5 to protect them since they can't get the vaccine?
So the number one thing they can do is make sure everybody else who's eligible in the household is fully vaccinated and boosted. That will certainly reduce the risk of them bringing home the virus to that younger child. And then when that younger child does have to be out and about, because there are plenty that do need to be in preschool and daycare and such, if they're 2 or older, encourage them to wear a mask, recognizing that especially the youngest ones might not right away be able to correctly and consistently wear it, but starting to teach them and to the extent possible. But the main thing is getting everyone else in the household fully vaccinated and boosted.
Thank you. Samantha, go ahead.
Hi, Dr. Traxler. Thanks so much for taking the time. My question really centers around this new Columbia Place Mall site. The biggest question I think a lot of people have is, because you're moving the site, hopefully it'll be faster, more efficient. Does that mean that test results are going to come faster? And what is DHEC doing to maybe get some of those tests come back quicker in a quicker fashion?
Sure. So we do hope, as we continue to work with, as I said, with our lab partners and our vendors, we do hope and expect to see here in the coming days the turnaround time, meaning how long it takes from when you get the swab done to getting results back, to return much more closely to that standard, 48 to 72 hours. In addition, as I noted in my remarks, people can go and just drive through and pick up a at-home saliva test kit with prepaid postage that gets mailed to a lab, and I'm told is having similar 48 to 72 hour turnaround times, and so they can, from their comfort of their own home, produce their specimen in the tube and then drop it in the mail for, again, about the same turnaround time and not having to wait potentially in a long line for a swab.
Thanks. Alex, go ahead with your question.
Hi, Dr. Traxler. Alex Tejada with ABC Columbia. I know at the beginning of the pandemic, there was a lot of emphasis on contact tracing. Is there any idea of where all these COVID cases are coming from? What can people do to kind of prevent them from getting them? Do they need to do less socializing during the winter, or what can we do to kind of keep ourselves safe?
Sure. So we are seeing that they're coming from a little bit of everywhere. They're coming from the community and from households. When we are seeing the case numbers that we're seeing right now, that level of transmission, I mean, this is widespread transmission. And so we are not going to be able to nail it down, even with contact tracing, to, for example, a specific place. Anytime you're around people, especially outside your household, you are putting yourself to some degree at risk, certainly recognizing there are various degrees. And what everyone can do then, since we are all going to be exposed if we're around other people, is number one, get vaccinated. Get fully vaccinated. If you are already fully vaccinated and you're eligible, get that booster shot. Being vaccinated with as many doses as you are eligible for, so maximally vaccinated, is the most important thing you can do to protect yourself. And then certainly when you're around people from outside your household, especially if you're going to be closer than 6 feet from them, or you're going to be indoors with a fair number of people, wear a good mask and wear it correctly and consistently. There's really more evidence with Omicron being more transmissible that maybe our good old cloth masks need an extra layer, and so add a disposable mask with it. Or certainly the KN95 gives even more protection if you have access to those. But so wearing a mask, then the most important thing is any mask is better than no mask when you're around others, and wearing it correctly and consistently.
Thank you. Tina Terry, go ahead, ma'am.
Hey there, Dr. Traxler, Tina Terry, WSOC TV in Charlotte. I hope you're doing well. Forgive the beeping there. So I had a couple of quick questions. You mentioned the 500,000 rapid tests ordered for the public, and then a separate 1 million point of care rapid antigen tests. Have the antigen tests arrived yet? And could they help increase testing sites or provide lower wait times at some of these locations? That's
Sure.
one question.
Sure. So I do want to clarify that both the at-home, over the counter, and these point of care are both rapid antigen tests. So they're both antigen ones. The point of care ones have to be performed, as I noted, by a medical professional, healthcare worker, and they also therefore technically need a provider's order. It's usually a standing order. They also have to have either a CLIA certificate or waiver, and that's a lab certification type thing. So it is not as simple as putting potentially folks out in a parking lot and performing these. And so we are envisioning these more for use among our first responders that are out there, trying to continue to take care of all of us and don't have access to in-hospital type testing. Certainly to congregate living settings, correctional facilities, and to various other of those type entities that have nurses and other medical professionals, as well as physicians who can give the standing order, and they have the lab certificate or waiver they need. And then the over-the-counter at-home ones are the ones that really can be done more any place by anyone.
Okay, is Premier Medical Lab processing all of the tests from your testing sites? And what parts of the state are people experiencing these delayed test results in? And what specifically have you all done to help with this?
Certainly. So Premier is not the only lab. We have contracts with either directly or indirectly with vendors and I believe Ron can get you this number, but I believe it's 9 labs, and we are sending specimens. We are doing everything we can to get them to places where they can have the fastest turnaround time. Premier does do a very significant proportion of the state's lab testing. And so there are sites from really any part of the state. There might be a site that sends to that lab, but we are working with them, as I said, to help them get caught up. And we are also working with our other lab partners if we see that there's any space, any capacity to help shift tests, et cetera.
Thank you for your question, Tina. Heather Gale.
Yes, thank you so much for your time. We appreciate you doing these every week. Are you all seeing second or third infections, or are these all original cases, or is that not something that DHEC has decided to track?
So when you say second, you mean like reinfection where somebody would previously?
Yes, personally, I know someone who was infected at the beginning and she just tested positive again yesterday.
Sure. So we have known throughout this pandemic that reinfection with this coronavirus was possible. And I think that we are seeing it. I can tell you that anecdotally, I know of people that have reinfections. I don't think we are tracking that data in particular, mainly because I don't know that with not being able to do a case interview on every single person, we might not have complete data on it. But it is possible, and there is some early potential data that shows that maybe being infected with reinfected, in other words, getting infected with Omicron when you were previously infected with Delta or Alpha or something is maybe a little bit more likely even. In other words, that any kind of natural immunity you had from another strain is not as protective, so that it is possible. So that's why it's so important to get vaccinated.
Thank you. Sam, go ahead with your question.
Hey, Dr. Traxler, can you hear me okay?
I can.
Cool. Thanks for taking our questions. I wanted to follow up on Dana's question about quote unquote incidental patients. Those who are in inpatient beds who tested positive but aren't necessarily in the hospital because of COVID. Does DHEC have any plans to start tracking that data at the statewide level? I've seen it, just looking at news clips at the healthcare system level and hospital level in the country. I'm just kind of curious if there are plans to do it, and is it even technically possible, or should we direct questions like this to local hospitals in our areas?
At this time, we do not have plans, and I will briefly explain to you, I think, why you're seeing only healthcare system level data from anywhere. The hospitals report through all nationwide through the same system, both to the federal government and to us at the same time. Their patient counts, ventilator counts, all that sort of thing, and so that's where we get that data. That is already, a burden that is put on them, that is necessary, but is put on them to do once a day. And so to do an even more detailed breakdown would take even more of the hospital resources and time and staffing to report that, as well as there's not components of this database and system in place. I don't know if the federal government has any plans to change it, but at this time, you really are going to only find the healthcare system level data for that reason.
All right. Thank you, Dr. Traxler. Jane, go ahead, please.
Yes, hi, Jane Robelo with WYFF4.
Hey,
hi,
Jane.
Dr. Traxler. Thank you so much for your time. It's always good to see you.
Good to see you too,
question,
and not on my
thank
TV.
Well, yes, you will be on my TV a little later on, thanks to you. A quick question about children. Do you have data right now on how many children are hospitalized with COVID in the state, and how many of those children have underlying health issues like obesity, et cetera? Thank you.
Sure. So we do know that there are 54 as of this morning, 54 in the 4 children's hospitals statewide. There are 54 children, so 17 years and under, who are hospitalized with COVID-19. We do not have data on those hospitalized children's comorbidities or presence or absence of them. We otherwise know that it is an even split today, that half are over the 8 or 5 or over, so they're eligible for vaccination, but they're not vaccinated. And the other half are not vaccinated, but it's because they are too young. They're not yet eligible. They're 4 or younger. So there are no fully vaccinated children that are hospitalized as of this morning.
Thank you for your question. Floriana, go ahead, please.
Hi, I was wondering a little bit about the testing backlog. Do you have any numbers of how many tests may be backed up, and maybe when these tests, how long people should expect their test to take?
So I do not have those details to know how many specimens is in a current backlog, and I don't really have any concept of a number to estimate for you. Ron can follow up and see if that is information that we have, or if we have received here recently. At this point, if people have not gotten their test results, if it's been more than 72 hours, certainly if it's been more than several days, they should reach out to our testing call center. But we do ask that people only reach out once. Part of our backlog in responding to people's calls and emails looking for their test results is because we have so many coming in that we are behind, but we also then have people sending multiple messages and leaving multiple voicemails. And so that going through those and weeding through which are the new ones and which are repeats only takes more time. So if it's been several days, do please reach out, but we ask that you only reach out once.
Thank you. And I have one more quick question. With people with the vaccine still transmitting the disease, how would you still encourage people to still get the vaccine? And does requiring a vaccine to get into places make sense?
So we know that people who get the vaccine can still be infected. We also know they can still transmit the virus. However, we know that they are less likely to become infected and therefore transmit the virus. The biggest reduction, though, that we see, the one that we can guarantee really, is that that data is there to show a statistically significant decrease in the hospitalizations and deaths, so the severe illness. So that's why we encourage people to get vaccinated, is because even if they do become infected, they are much more likely just to have either no or mild, at most some moderate symptoms, and come through this just fine without going through that severe illness.
Thank you. And I'll go to Becky before we switch back to a follow-up. So Becky Buds, go ahead, please.
Hi, thank you for your time today. My question is in regards to the new Columbia Place Mall testing site. I'm curious if DHEC has any idea of how many tests that site will be able to perform a day. I understand it's going to have 8 lanes and all this new capacity. If you have any specifics on the number of tests that would be performed there and how much it can handle, that would be great.
And we do have that information. I do not have it on the top of my brain at the moment. I have heard that number and do recall being quite impressed by it. But Ron, if you could follow up with the team, I know that we could get that information for Becky, because I do know that they have a capacity basically number. As I said, it was impressive and should be enough to keep this flowing.
Thank you. And then in that, if you have comparison of what the Bull Street testing site was doing, that would also be super helpful. Thank you so much.
Sure, we'll follow up.
All right, thank you. I do want to see if Dana can ask her follow-up question.
Yeah, this one's fast. Has South Carolina or any of its partner pharmacies received a supply of the Pfizer and/or Merck antiviral pills that people can use at home? So
we just did. We're going to be sending out information to providers to let them know we got very limited doses. I can tell you this first go round, and anticipate similar for in a week or two for our next go round. We received about 800 patient courses of the Paxlovid, the Pfizer one, and about 3,700, 3,400 of the molnupiravir, the Merck product. And these will be at about 8 different pharmacies that are statewide. And as I said, they do require a prescription, and we're going to be getting the information on those to the providers here in the next today or tomorrow.
Thank you for your question. I did not know, Dr. Traxler, do you have a hard stop at 2:30?
No.
Okay.
I have my next meeting's I think at 3.
All right, good. All right, I believe next in line was Ayla. Go ahead, please.
Hi, Dr. Traxler. Just a follow-up question on the rapid tests that we are awaiting, the 100,000 that we have, and then the 500,000 that are still on the way. Given the fact that you guys are suggesting schools and students can start using these at-home tests to try and get back in the classroom sooner, is that something where some of these could be allocated directly to districts to then give out to families? And additionally, we have several schools here in the upstate that are moving to e-learning for the next several days as we speak. So if you could just comment on that quickly, that would be appreciated as well.
Sure. And so, yes, we are looking to get some of the rapid tests to schools. We actually have had a point of care rapid test program in place since a little over a year ago with the Binex Now, the Abbott Binex Now rapid tests. Those are point of care tests, not to be confused with the at-home over-the-counter version with the same name. But there are about 39 or 40 school districts throughout the state who have been participating in that program, and that's one where their school nurses can administer the tests, and they're using it in a variety of different scenarios. And some of them are using it if people get sick while at school. Some of them are using it for return from quarantine. A variety of different methods. So we will continue to provide those tests that we get on a weekly basis through a federal contract to school districts. I think there are also about 13 charter schools that use those as well. And we are hoping to potentially be able to, increase even if there's more that want to come on now. In addition, we are looking to allocate some of the rapid tests that are coming to schools and school districts, looking to use the ones that are the at-home ones, especially for school districts that may not have full-time nurses at all their schools, or where access to testing may be lower than in other parts of the state.
All right, thank you. We're going to go in the order of Samantha, then Tina, Sam, and Ayla, if she still has a follow-up after that, and then that'll be all of our questions for today. So Samantha, go ahead, please.
Hey, Dr. Traxler, just to follow kind of to what Ayla was getting at there, you know, obviously for these schools that are having to close down or go virtual for a short period of time, it's because they have a number of positive cases or they're quarantining, the close contacts are major. So what kind of guidance is DHEC giving to school districts here in the Midlands and really across our state in terms of what it looks like to get back open and hopefully keep infections on the other side of this brief e-learning period at bay?
Certainly. So in our guidance, just as we've had in there in previous versions, we do give some considerations for when a district might want to temporarily go virtual. And one of those is if they, you know, there's criteria for based on how many cases or percentage they're seeing in their student population or their student and staff population. And then there's also certainly if they can't maintain staffing, if they don't have enough teachers and can't get them. And so I think the reason for which they go virtual is partially going to determine the duration. And my recommendation then is for everybody associated with the school. So for parents, students, teachers, staff, if they're going virtual, to take that time to increase each of our mitigation measures. So get vaccinated if you haven't done so. You know, really try to take care to wear a mask when you're around other people. And basically the concept behind you know, anything, a school, a district, a grade, a classroom going virtual is to stop that chain of transmission if there is any occurring potentially in the school. And so that gives, by taking several days, and it's shorter now with Omicron than it was before, by taking that time period where these folks are not around each other to be passing it around, then by coming back into school, they hopefully have broken that chain of transmission. And so the guidance to them coming back in would again be the exact same guidance that they have before they left. And that is for everyone who's eligible to please get vaccinated and boosted when you're eligible. Please wear a mask in school and when you're in public. And then certainly to get tested, especially if you are not feeling well.
Thank you so much. Tina, go ahead with your follow-up. Tina Terry? If Tina is not there, Sam, go ahead with your follow-up, sir.
Thanks, Ron. In terms of the rapid test orders, Dr. Traxler, what brand or brands are those?
I don't want to start naming because I will forget and leave one off, and I don't want to do that to any manufacturer or brand. They are different brands. They are not all the same brand, but they all are FDA emergency use authorized for this. And you know, we have verified that they are legitimate and can be trusted.
Thank you. I'll give Tina one more chance. Tina, are you there?
Yeah, I am. Sorry, I was unable to unmute for some strange reason. But yesterday, several districts said that they would not participate in the approved Test to Stay program due to a lack of testing supplies and just the delays in getting results back, as well as delays in staff to process results, you know, in that program. Do you guys have any plans to kind of help districts with that? Obviously, that is a attractive program, but they're just saying they don't have what they need in order to implement it at this time. And then just to the second part of my question is, can you just elaborate on who should be taking those 500,000 rapid tests? Where will they go? How will it help with the testing issue?
Certainly. So with the Test to Stay program, it is completely optional for districts because we recognize that that some districts are going to have an easier time implementing it for a variety of reasons, of which one is the availability of tests. than others. But because the CDC's data was out there and has shown that this mechanism is safe, and because we want kids in person in school, whenever they can do it safely, we wanted to make this option available immediately to the districts, especially, that could right off the bat do it. We will be working with districts then we already are, and over the coming days and weeks to, as I noted, either bring them on board for some of our testing, our rapid test options that we have, or to work with them for distribution, some of these rapid tests potentially. We are committed to really prioritizing keeping kids in school for use with the point of care, and then to some degree too, also the rapid tests, the at-home ones. So this really is a priority for us, and we're going to be working with districts. But we wanted to go ahead and get this guidance out while we started working with them to have available to the districts that wanted to go ahead and could implement it. And in regards to the at-home, the 500,000 at-home rapid tests, as I said, more specifics about the distribution and if people want to get one, how they potentially could, et cetera, will be coming out in the coming days. Our team is hard at work right now processing the 100,000 that have arrived and getting those prepared at our site. And you'd be impressed. I saw a photo of what 100,000 tests look like. It's not a small amount when looking at it and considering the logistics. And so what we want to do with that, though, with that program, with the rapid test program, is number one, again, keep kids in school. Also, number two, help keep people in the workplace. We're aware of that. Really, no industry is completely immune to this, and there are staffing shortages in a lot of different areas. And so we certainly want to support that. We want to support especially our healthcare workers and first responders, so that they can take care of all of us. And just to the general public, if you can know that you need to isolate and people around you need to quarantine, the sooner you know that after you develop symptoms, then the less likely there is to be transmission.
Thank you so much, Dr. Traxler, for your time today. And thank you to all the media present for your valuable time and your continued coverage of COVID-19 in South Carolina. Take care, and we will see you at our next scheduled briefing. Thank you so much.
See y'all next week.